Hello, everybody. My name is Dr. Karan Lal. I'm a board certified pediatric and cosmetic dermatologist in New York and in Arizona. And today we are fortunate enough to be doing an Aerolase Neo treatment on a patient here. We have wonderful Dana who's going to do the treatment, and I'm going to walk through the purpose of the treatment, what we can do with this type of treatment, the settings, and how we coordinate the settings for this type of treatment. And so, just to give you guys some background, the Aerolase Neo derm system is a 1064 Nd:YAG laser, and I caveat that by saying it's not a regular Nd:YAG laser. So unlike other Nd:YAG lasers where you have a fiber optic cable that is connected to the laser, this is different in that the laser is in the handpiece. So when Dana's holding that device in her hand, that is the actual laser. And so the pulse duration is fixed. It's 650 microseconds, which is quite fast. And why is that important? Because that specific pulse duration has been shown to work on a number of different chromophores, including hemoglobin, deoxyhemoglobin, and water, and also melanin. So we're going to be working on 4 different chromophores in this type of treatment. You can use it to treat acne, rosacea, erythema, telangiectasias, angiomas, melasma. It's really good for patients that have vascular melasma, mixed melasma, which I think is the most common type of melasma we encounter in the office. And so, oh yeah, and so we have her on a setting of 5, right? Six. And we have a frequency of 2. So you're going to see how fast the treatment is. And typically we do anywhere from 3 to 4 passes. This is a painless treatment that does not require topical anesthesia. It is safe on all skin types. And like I said, we're using it to treat primarily for this patient. She has some facial erythema. She might have some keratosis pilaris, rubra. And so this is a great treatment. And because you don't need topical anesthesia, you can use it on kids. And so I use it a lot on pediatric patients that are teenagers for acne. And typically, people will notice within 24 hours an improvement in their acne. And the reason is we're using it to treat not only inflammation, but erythema. We're reducing the bacterial load on the skin and this level of the sebaceous gland. And so it's one of those great treatments, like I said, in my office. It's something that we do routinely. I mean, it's the device that we depend on. Where I did my fellowship, I had 4 of them, and they were always in use. The other thing I like is I have primarily a mixed skin and color population, and it's very hard to find a device that you can use. You can't use a pulse dye laser. You really can't use a regular long pulse Nd:YAG laser for vessels because the pulse duration is competes for melanin and you can cause dyspigmentation. And so the fact that it's a 650 microsecond pulse duration and it's been studied to treat pigment is fantastic. You can also use it for pseudofolliculitis barbae. You can also use it for thin hairs like around the eyebrows. So I have a lot of people that come in that want to get their eyebrows done. They're You can also use it for people, for women that have facial hair or hirsutism around the mouth. You can also use it to treat psoriasis, so it treats the vascular component of psoriasis, which we've done plenty of times. And you can also use it to even treat pre-skin cancers. So this is a great treatment. It works for lentiginous. Ideally, you're getting 4 different types of treatments in one because we're addressing 4 different types of chromophores. And this is a treatment patients can do every 2 weeks if they wanted to. They can do it every 4 weeks if they wanted to. And typically, we have a different treatment protocol and series for the different type of platforms or treatment conditions that we're going to have. So, how do you feel the treatment is? Amazing. She said amazing. And again, she has no topical numbing. There is no downtime with this procedure, so you can combine this with microneedling. You can combine this with chemical peels. You can combine this with other fractional laser devices. You can combine this with an erbium. We also have an erbium on the front that has a fully ablated and a fractionally ablated handpiece, so you can get what we call a stacked treatment. We also have a patented reverse protocol that uses both the Neo and the Era, which is an erbium and an Nd:YAG treatment to help with a number of different concerns and help to reverse the signs of skin aging. And that's something that if you're interested in, we can talk to you about on the side. But as you can see, the treatment is pretty quick. Patients are usually done within 10 minutes. And also, we notice that after treatment, the skin is more permeable. So you can use your actives right away, and people are going to have an even better outcome, especially when you're treating them with acne, if they're using topicals for acne. So if you have any questions in particular, you can ask me or Dana or Hannah or anyone at the booth here that has knowledge. We've been using this device for a number of years. And like I said, you should try to give it a try. It's very easy to use. It has really one button is this set the energy that you're going to use, and the energy is graded. So like I said, it's a treatment that is easily done on the face. You can also use it on the body, so you can use it for stretch marks. You can also use it for poikiloderma of Savant, especially when people have that pigmentation and erythema on the neck and on the chest. So I would say it's one of the most versatile lasers I have in my office. What do you think?
I agree.
And you've been doing this way longer than I have, and the best way possible.
It's great for preventative.
Yeah.
Building skin.
Yeah. So it also is great, like you were saying, for prevention and skin health and collagen stimulation. These are all popular terms that people really like. People will tell you that they have an immediate glow after this treatment. So I have a lot of celebrities that want to come in and they want to get an immediate treatment before a red carpet or an event, and it comes out great. And like I said, because it has no downtime, it doesn't affect what patients are going to do afterwards. They can go to the gym right away. It's not like some of the other treatments. Their skin is not open. They're not at risk for infections. It kind of feels like a warm massage on the face, to tell you the truth.
Yeah.
And there's different spot sizes. So spots, you're using a
6 millimeter.
6 millimeter spot size.
Which is our largest.
And then you can use the smaller spot size to treat veins, like telangiectasias, venulectasias, on the nose and on the legs. You can also use the smaller spot sizes to treat cherry angiomas. You can also use it to treat pigmented lesions. So we have a number of different things, like I said, we can treat with this laser, which is very exciting because in the US, minimally invasive treatments are the most popular. I think that's a trend everywhere. People want non-ablative treatments. They want low downtime. People are more interested in coming back more often as opposed to just doing one big treatment all the time. And the fact that you can stack it with your neurotoxins and your fillers. In fact, sometimes we would do filler and do the treatment right after to prevent bruising or reduce bruising. So just another way to combine this type of treatment.
She's almost done.
And we're almost done. And if you guys have any questions, I'd happily answer them for you. Either about this or the ablative erbium device, which is sitting out there in the Era, which now has a fractional handpiece as well. And that's really good for periocular rhytids or wrinkles, perioral rhytids.
She is done.
Wonderful.